1. In which bone does the fossa for lacrimal gland is located? A. Lacrimal bone. B. Orbital part of frontal bone. C. Orbital part of ethmoid bone. D. Orbital part of maxillary bone. E. Orbital part of greater wing of sphenoid. The answer is B. Orbital part of frontal bone. 2. Which of the following spaces first receives the aqueous humor secreted by the ciliary body? A. Anterior chamber. B. Lacrimal sac. C. Posterior chamber. D. Pupil. E. Vitreous. The answer is C. Posterior chamber. 3. A part of the eyeball which is visible through the transparent bulbar conjunctiva as the white of the eye. A. Ciliary body. B. Aqueous humor. C. Cornea. D. Sclera. E. Fundus. The answer is D. Sclera. 4. All of the following structures pierce the sclera of the eyeball. Which one is the exception? A. Optic nerve. B. Vorticose veins. C. Posterior ciliary vessels. D. Central vein of the retina. E. Anterior ciliary arteries. The answer is E. Anterior ciliary arteries. 5. Not a part of the refractive media of the eyeball. A. Cornea. B. Aqueous humor. C. Lens. D. Vitreous humor. E. Ciliary body. The answer is E. Ciliary body. 6. A 22-year-old woman is admitted to the hospital with an injury to her eye. The corneal reflex is tested and found to be present. Which of the following nerves is responsible for the afferent limb of this reflex? A. Frontal. B. Lacrimal. C. Nasociliary. D. Oculomotor. E. Optic. The answer is C. Nasociliary. 7. Which one is responsible for the red eye reflection that occurs in flash photography? A. Pupil. B. Iris. C. Choroid. D. Optic part of retina. E. Pigmented layer of retina. The answer is C. Choroid. 8. All muscles are innervated by the oculomotor nerve, except which? A. Inferior oblique. B. Superior oblique. C. Superior rectus. D. Inferior rectus. E. Medial rectus. The answer is B. Superior oblique. 9. The muscles or nerves that are responsible for adducting the eyeball include the following except which? A. Superior rectus muscle. B. Inferior oblique muscle. C. Medial rectus muscle. D. Oculomotor nerve. E. Inferior rectus muscle. The answer is B. Inferior oblique muscle. 10. A 55-year-old man is diagnosed with a tumor at the base of the skull, resulting in a decrease in tear production. Which of the following nerves is most likely injured? A. Deep petrosal. B. Greater petrosal. C. Chorda tympani. D. Lesser petrosal. E. Nasociliary. The answer is B. Greater petrosal. 11. Not a content of the infratemporal fossa. A. Masseter muscle. B. Inferior part of the temporalis muscle. C. Pterygoid plexus of veins. D. Maxillary artery and its branches. E. Lateral pterygoid. The answer is A. Masseter muscle. 12. All of the following are branches of the first part, mandibular part, of the maxillary artery, except which? A. Pterygoid. B. Anterior tympanic. C. Middle meningeal. D. Inferior alveolar. E. Deep auricular. The answer is A. Pterygoid. 13. Which one of the following landmark structures is important to identify the second part of the maxillary artery? A. Temporalis muscle. B. Lateral pterygoid muscle. C. Condylar process of mandible. D. Medial pterygoid muscle. E. Lateral pterygoid plate. The answer is B. Lateral pterygoid muscle. 14. Which of the following protrudes the mandible? A. Medial pterygoid. B. Lateral pterygoid. C. Masseter. D. Temporalis, posterior fibers. E. All of the above. The answer is D. Temporalis, posterior fibers.